you or I go shopping for a toothbrush, how much do we pay? $2, $3, maybe $4? Well, guess what one hospital once charged a patient for a toothbrush? $1,000. Can you believe it? $1,000 for a toothbrush. And you know who ends up paying for that? You and I. We end up paying for it. It comes out of our pocket in one way or another. And that's not the only crazy hospital cost I've run into. Come on, come with me. And at the store, how much does a bottle of Tylenol cost? $10 for 100 pills. Well, we know of someone who at the hospital was charged $140 for one Tylenol. Can you believe it? $140 for this. Now, here's a box of disposable gloves. When you buy them here at this store, they come out to 24 cents a pair. But I know of a hospital that charged $53 for a pair of gloves. That's right, $53 for a pair of disposable gloves. What the heck is going on here? So I'm here in the home office of a medical billing advocate. This is Cindy Holtzman, and she helps people cull through all of these crazy charges, and she has all sorts of examples. I got to tell you, Cindy, this is one of my favorite ones. This is just like a little alcohol prep swab. We've all had these. How much did a hospital charge for these ones?
$23 a piece.
$23 for this little tiny piece of cotton.
And on one bill, there were 44 of them. Becomes very expensive.
Oh my goodness. But this isn't even the craziest thing you've ever seen. Tell me about one of your crazier charges.
Well, recently I had somebody that was charged for 41 IV bags when she went to the ER for a 2-hour visit.
Oh yes, you heard that right. A woman went to the emergency room with a migraine headache, and they gave her one bag of saline, and then they charged her for 41 bags of saline to the tune of $4,182. Now, the really crazy thing about this is that her insurance company actually paid this bill. They didn't even question it. So why did her insurance company pay for this when it was obviously wrong?
There's not many people working at these companies anymore, and they're very busy, and usually any kind of bill that's under $100,000, they don't look at the details.
So they just write a check.
They just write a check.
That's shocking. Are those errors, Elizabeth, when you talk about the 41 bags, or do hospitals know that the insurance companies aren't going to look at it?
Oh, well, it's a combination. No, the hospital, it was an error. They actually fixed it when the patient brought it to their attention. That hospital wouldn't speak to us, and the insurance company just paid for it because that's what they do. They often just pay for these things as long as it's under, say, around $100,000. The insurance company in this case said they couldn't talk to us because of privacy reasons.
You know, and some people may say, you know what, I have insurance, so why should I care if, hospitals are overcharging if the tab gets picked up anyway? But really, all of us need to care about this.
Oh, absolutely, because it comes out of your wallet. I mean, when charges go up, 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 your premiums go up, up, up. So one of the major reasons why we're paying so much in premiums is because of this medical waste. I know I see it coming out of my paycheck, and we all see it coming out of our paycheck.